So as a family physician, when I prescribe a medication a patient needs and that patient can't afford it, it's very disempowering to that patient. And we actually know that 1 in 10 of our patients cannot afford the medications they need. It's completely demoralizing. It leads to worse health outcomes, worse mental health outcomes, and increased burden to the actual system. So pharmaceutical policy should be integrated into the whole system. We cannot look at parts of the system in silos. We know if people cannot afford their medications, that they're going to have increased hospitalizations. There's an increased burden of the cost of disease. And so for us to try to cost contain or improve outcome measures in other parts of the system without actually looking at pharmaceutical policy, it's ridiculous. We have to look at everything as a whole if we're actually going to get the outcomes and improve patient care that Canadians deserve. If we don't take action, I think things are actually going to worsen, because as we see the chronic disease numbers go up in this country, and we know there's an increasing burden of it, if we can't get on top of it in terms of not only the prevention and promotion of healthy life choices, but actually the treatment and nipping these diseases in the bud to get them quite well controlled, if we don't do that, the costs of the system are going to become more and more unsustainable. So we have to get a healthy pharmaceutical policy in place. I feel that change can come from the grassroots up, from individual physicians as well as patients, into trying to influence policy changes. It cannot just come from the top down. So it's the responsibility of all Canadians, including Canadian physicians, to do that.